What's up, Sono Peeps? Welcome back to my channel. Now, if there's one thing you should probably know about me is how pathetically in love I am with medical dramas, especially Grey's Anatomy. I mean, it's like to the point where it's like if you see my room, there's gonna be at least, I don't even know how, like 10 things Grey's Anatomy. You look at my wardrobe, I think I have like 4 things Grey's Anatomy. I've got Grey's Anatomy scrubs. I've got it all. And if you don't believe me, why don't you ask my wonderful friends, Dr. Meredith Grey and Miranda Bailey. I wanted to get the Christina Yang and the Derek Shepherd one, but they were sold out by the time I could get them, so got my 2 besties right here. Now, as much as I love Grey's Anatomy, I can also admit that they are not 100% the best or 100% accurate about what it is to work in the medical field. Hello, it's medical, but it's still a drama show, and everything's gonna be all spoofed up and a little spicy there for our entertainment. And at the end of the day, they're actors, they're producers, they're directors, they're not medical workers. So they can be as precise as they can possibly get with medical, but there's gonna be 1 or 2 things that are like, what is that? You know? So today's video, I'm going to be reacting to ultrasound scenes in Grey's Anatomy. Now, when I watched through Grey's Anatomy, and I'm not even caught up yet, but when I started watching Grey's Anatomy, really getting into it and started binge watching it, this was before I got into ultrasound school or while I was still in my prereqs. So it's like, hey, look, ultrasound, but it's not like I really like went in and was like pointing out stuff that it's like, hey, I know about that, I know this, I know that. Like, I didn't. So now it's time to go back and watch these scenes with fresh, new, professional eyes, and let's get to it. I think I'm gonna make them watch us judge them, shall we? Let's do that. So they're gonna be just kind of sitting there hanging out while I judge them. This is all constructive criticism, you guys. Don't get upset. All right.
You're not miscarrying.
Well, then it's an ectopic. Could it be a blighted ovum?
It's not a molar pregnancy, is it?
Wow, we got a lot of doctors in the room.
Who the hell are you and what are your credentials?
Lucy Fields, Harvard MD, Duke OBGYN resident, now maternal fetal medicine fellow at Seattle Grace Mercy West. Damn good at my job. Who the hell are you?
We're related to the...
Oh, that's a situation. Lesbian lover baby daddy.
Ah, and everybody's a little wigged out. Okay. So... there's your baby. There's the yolk sac. Looks good. You're good.
I'm bleeding.
It's not uncommon. Happens in around 30% of all pregnancies. It's probably fine.
I don't see a heartbeat. Where's the heartbeat?
Well, it's probably too early for that. I'll do blood work, but I'm pretty sure everything's okay. Just take it easy for the next few days. Drink a lot of water, no tampons, no intercourse.
Sing it.
Call me if the bleeding gets worse or if there's pain. Otherwise, go live your life. All of you. While you still can.
Okay, so it looks like she's doing a transvaginal study. But when she goes to the screen, okay, that's a trans-abdominal view of the uterus. She said there's the yolk sac, and then like, I didn't even get to see what she was pointing at. I don't think I saw a yolk sac. I see what could look like a fetal pole, but then again, they like switch so fast in between the scenes that it's like, and if the fetal pole is that big, I can't even tell, but if the fetal pole is that big, I'm sure there probably wouldn't be much of a yolk sac anymore. I don't know, that's crazy. But it is true, we get a lot of patients in the ER that come in for bleeding while they're pregnant, especially in their first trimester, and usually everything ends up okay, and they always ask me the same thing. Like, so why am I bleeding? What could be happening? And it's like, it's not uncommon, like she said, but it is better to be safe than sorry, and that's it.
Oh, it hurts. I know, just try to relax, okay? Do you hear something?
A swooshing sound?
Like her sandwich digesting?
Or like a vascular bruit. Here, let's try the ultrasound.
Sure.
Yeah. And to the right. I'm gonna press. Sorry. Take a deep breath for me. And exhale. There. Oh, the median arcuate ligament.
You've got Miles. Whoa! I've only read about this.
A ligament is wrapped tightly around your celiac artery. It expands when you eat. You know, no one's found it because you always fast before your visits. We can go in laparoscopically, cut it. Takes 20 minutes.
Okay, I don't know much about what she said about Miles. I've never seen it. I'm just so appalled at how fast the ultrasound machine turned on when she said, let's try ultrasound, and just said beep. And I was like, wait a minute. Also, I saw that she was in, let me see. She was in transverse, wasn't she? The fact you can hear pulse Doppler when she's still in B mode. Deep breath, yeah. We always take a deep breath to get a better visualization, especially when it comes to the liver or anything in the abdomen. Taking a deep breath will help that. She doesn't even have pulse Doppler on, is what I'm saying. And then the first scene she's on B mode, and then she's on color Doppler, and I was like, okay. But like I said, I don't know anything about this condition, I guess, or disorder. And I don't know that it's easily seeable with ultrasound. But that was a good learning thing for me. I'm gonna have to look that up.
Refreshing it is to have a couple come in together. You'd be surprised how many husbands don't even want to come into the office, much less the exam room.
Yeah. It's just we're really close, right, honey?
Well, right breast looks nice and healthy. Doesn't seem to be any problem there at all. Yeah, more often than not, these inconclusive mammograms turn out to be nothing, but you know, better safe than... Yeah, this looks slightly less than good. Unfortunately, I am seeing a solid lesion in the left breast.
So I definitely have breast cancer, huh?
Yeah. Can you show us what that looks like on that machine there, Doc?
Yeah. You see this area right here? And that's the lesion. And then there's a small one right there.
That is really there.
I have breast cancer.
First of all, what I just said, it sounds like you're hearing a heartbeat as soon as he puts the probe down, which does not happen. Second of all, at least in a regular outpatient or hospital setting, doctors do not scan patients unless it's indicated or a tech needs help, obviously. They probably don't know what they're looking at. They ask the doctor to come and see. Doctors don't just come out and say, all right, you have a solid lesion, cancer. They're like, okay, it is very suspicious for cancer or any kind of malignancy. I didn't see that it was taller than wide, but again, that's just an indication. You would go through a biopsy first. Biopsy, blood work, all that jazz before they can confirm, okay, you have breast cancer. And especially now while you're actively scanning the patient. You can have your suspicions and you can run more tests, but you don't just say, hey, there's a solid lesion right there, and then just be like, yeah, that doesn't look good, you have cancer. And like, that's it. There's a part 2 to this one.
You're sure that I'm clean? You're 100% sure.
Look, they look totally clean. See for yourself. She's like...
Oh, we're way past that.
You okay?
I'm okay. He fakes the ultrasounds.
He is poisoning completely healthy women, probably just to charge them for the chemo.
No.
What he does to these women, what he puts these families through.
We need to stop him.
No, we need to destroy him. Owen.
You told me not to take it out on the interns.
I'm okay. I'm really okay.
Yes. Your scans came back clean. Dina, you do not have cancer.
Oh my God. Oh my God. Oh, this is a miracle. I have to tell Dr. Hansen.
Actually, Dr. Hunt is telling Dr. Hansen right now.
Oh my God. Oh my God.
So this second one, I don't know much about breast. I am a general tech. I don't know that they're sitting up like that, usually through breast ultrasound. When I've had ultrasounds done and when we do ultrasounds over at where I work, they're always laying down with their arms up like how you see there over their head. Usually sometimes we'd have to roll them to the side depending on like how the breast is, you know, like sitting, and depending on where the lesion could be. One thing I noticed that he said in the last video was about her mammogram being negative and better to be safe than sorry. At least from what I know, ultrasounds can't pick up a lot of what mammograms pick up, especially when they're really small sub-centimeter findings on the mammogram. So usually a negative mammogram is not going to be an indication better to be safe than sorry for an ultrasound, especially when the lesion that he saw on ultrasound was so like right there. How is it not going to be able to be seen on mammogram? That's my question. When she said you look clean, I mean, it is looking like dense tissue there. I mean, again, there's not so many scenes that you can actually see the screen, but it does look like she has some dense tissue, which can also be like sometimes mistaken, especially when women are, you know, self-examining and they feel a lump or something. Is usually when they have dense tissue that they're like, you just have a lot of dense tissue. It's normal in younger women, and that's really it. Next.
Another one? Is it bad?
You know when guys get kicked in their guys?
How do you know what that feels like?
Everything goes black. You want to throw up? Your whole body goes cold all over because of the pain.
That's exactly what it feels like.
This is worse.
We're gonna have a baby.
We're gonna have a baby.
Good news, Dr. Shepard. Based on the pelvic exam and cervical length on ultrasound, it looks like Braxton Hicks.
Braxton Hicks?
False labor, when the uterus contracts and relaxes.
No, I know what Braxton Hicks are.
So no baby.
Not today.
I really thought this was real.
Same.
Suddenly they hurt less.
Okay, first of all, there's something about the placement of the actual machine while these ultrasounds are being done. They're like all the way at the end of the bed where the patient can see, and at least in a hospital setting, that does not happen. We're usually on the right side of the patient and we see the screen. I don't know how that's comfortable being at the foot of the bed scanning backwards. Especially on transvag, I don't know that that's a thing. And judging by the beginning, okay, so it looks like a transvaginal view of the cervix. It looks like it's a little bit dilated there. And you can see some fluid kind of, so right by baby's head, you can kind of see the little funneling. It's not too bad. Obviously, she doesn't look very dilated. Cervical length looks like it would be over 3. I mean, she didn't even measure it. Hold on. And I'm not sure a pelvic exam, I mean, correct me if I'm wrong, again, I'm not OB. Pelvic exam and ultrasound wouldn't show Braxton Hicks. I thought Braxton Hicks was based on timing and intensity, and usually you can tell that on a monitor. Correct me if I'm wrong, text, but, and then I just love how it's like the one scene, she's like showing them, and then by the next scene, the machine's like off, and then she just leaves it there. I'm like, I don't think that's a thing. She like leaves it in there with them and just like walks away. I'm not sure I would do that, especially with patients who get curious. I've seen videos of patients trying to do ultrasounds on themselves in the hospital, and all I gotta tell y'all is if y'all drop the probe, I hope you guys have $15,000 to just throw away and buy a new one. That's all I'm saying. Don't play around with medical equipment. So guys, it looks like we're gonna need a part 2 to this because there's just so many scenes and we are already pretty deep in this video. Like I said, medical drama is great. It by no means highlights what actually goes on in the medical community, especially in hospitals, especially in hospitals as big as that one. My favorite is that in these shows, like all the doctors are friends or lovers when at the end of the day, I don't even know how many people I even talk to. Very small amount of people I talk to at my job. And we don't have time to just be diddy-daddling like they do in the show, but again, it's medical drama. I love it. So that was the sonographer's reaction to ultrasound scenes on Grey's Anatomy. There are definitely going to be more parts to this because there's a lot. Please comment down more shows that you would like to see that have ultrasound scenes in them because I would love to react to them too. What do you guys think? You guys learned something? No? Okay. So, oh, by the way, here are my nails, guys. everybody always wants to see what my nails look like when I post. These are my Valentine's nails. They're a little grown out. I should definitely put some highlights on my Instagram or something because everybody always wants to see what my nails look like. So that was all for today, guys. Don't forget to like, comment, and subscribe, and comment down your favorite medical drama show if you have any. That's gonna be our little theme there. So yeah, I can't wait to see you guys in the next video. Bye.